The First Minister doesn't like opposition politicians stating that the COVID pandemic can't be blamed for everything. Therefore, will she listen to the President of the Royal College of Radiology, Jeanette Dixon, this morning again said this: "It's not the pandemic that has caused the shortage. The pandemic has laid bare the shortages that were there before. It's also exacerbated the shortage as well because of diagnostic backlogs." That is from clinicians who are speaking to the government right now, saying don't use these excuses. It is clearly problems that have been built up for years and years. Now, last winter, we saw the NHS battle from crisis to crisis. Our ambulance service and A&E department struggled so much with patient demand that our United Kingdom Armed Forces had to step in. This year, we're not even close to winter, and the situation is far worse. Scottish patients are being sent to England for treatment that they can't get here. Well, the First Minister looks puzzled. We've spoken to Alan Turner, a 70-year-old from Kelso. He was referred for knee replacement in October. He was told he would have to wait up to 3 years to get that knee replacement on the NHS in Scotland. Or he could go to England for private treatment paid by Scotland's NHS. He reluctantly agreed to travel south, and he was successfully operated on. Then, when he returned to Scotland, he tried to get essential aftercare and physiotherapy locally, and he was told he couldn't for months. Alan is now back to square one. He can't even bend his knee. He'll need to endure the painful wait for treatment all over again. So while it's welcome that we can rely on services across our United Kingdom in times of need, First Minister, should people like Alan really need to go to England for treatment in the first place?
First Minister. Obviously, I'm happy to look into individual cases, but in general terms, that's a mischaracterisation of the position. And I point out to Douglas Ross again that while I don't shy away from the challenges in NHS Scotland, which are my responsibility, waiting times are worse in England than they are in Scotland. Accident and emergency waiting times are worse in England than they are in Scotland. Our accident and emergency departments that were mentioned by Douglas Ross are the best performing anywhere in the UK, although performance needs to improve. But let me come to the specific point that Douglas Ross, this was not somebody, certainly from the information that Douglas Ross has shared, I'm happy to look at any more information that is available. When someone is waiting on the NHS and are waiting too long for treatment, if it is possible for NHS Scotland, at NHS Scotland expense, to access treatment in the independent sector, it will do that in the interests of the patient. Sometimes, and there are agreements in place between Scotland and other parts of the UK for more specialist treatment, and they work in both directions. But in terms of standard, this patient, from what Douglas Ross has said, hasn't gone to NHS England for treatment. We have paid for treatment in the independent sector, so they are treated more quickly than they would be otherwise. That is what happens while we continue to invest in the improvement of waiting times on NHS Scotland. So we will continue to address these challenges, we will continue to invest, we will continue to support record numbers of staff in our National Health Service and get on with that job.
As much as the First Minister might want to try and blame the pandemic, she can't blame the pandemic for this one. This happened before COVID, and let me give her the stats. Between November 2014 and March 2020, waiting lists increased by over 5,000, the numbers waiting over 18 weeks more than trebled, and those waiting over a year increased from just over 200 to nearly 1,000 before COVID-19. But these statistics don't show how broken this system is. I was contacted by another mother whose son was seen after waiting 18 months. His treatment made a difference but ended in June last year. But his condition started to deteriorate by August and he was put back on a waiting list. And despite reporting suicidal thoughts, he is still waiting 11 months on. After waiting months already, why does a 14-year-old who has been referred, who has been seen, and who is now reporting suicidal thoughts have to start from the beginning again?
First Minister. I'm not going to comment on individual cases. I'm, of course, always happy to look at individual cases if these are sent to me. But in terms of the treatment that young people are entitled to expect when they come forward to CAM services, one of the other things that has been done in recent times is the publication of the National CAMS Service Specification, which sets out clearly levels of service. That's backed by £40 million of additional investment, and we are investing in more staff, but also, of course, reforming the way mental health services for young people work. Where young people need specialist services, they should be available, which is why the improvements that I have talked about in my earlier answer don't go far enough, but are important. It is also the case that we are trying to build up and are building up more community-based services so that fewer young people need to be referred to specialist services. So, for example, we have employed or supported the employment of counsellors in all secondary schools to support young people on an early intervention basis. So we will continue to take the steps to invest in mental health services, but also to reform mental health services so that they become more preventive and operate on an earlier intervention basis. The final point I would make, because Anna Sarwar is right, because I've stood here on many occasions and talked about these issues, that mental health in particular, we were seeing significant challenges before the pandemic, which is why much of the investment I have talked about has been happening. Partly this is because that more and more people, as the stigma of mental health reduces, more and more young people are coming forward for help. That is something we should encourage and be positive about, but it makes it all the more important that the investments and the reforms that I am talking about today here happen and continue, and that's exactly what the case will be.
Anna Sarwar.
Two cases I've cited are not individual cases. They are demonstrative of a wider systemic problem. And if mental health services are going to be taken seriously, we need reform of the referral and triage system. We need a mental health professional in every GP practice, and young people in every primary and secondary school need to have access to face-to-face mental health services. These are solutions, but all the First Minister has done again today is offer year after year is warm words. In 2015, Nicola Sturgeon said waiting times were too long. In 2016, she said there were far too many children whose needs were unmet. In 2017, she said long waits are unacceptable. In 2018, she said there is more work to do. In 2019, she again said long waits are unacceptable. In 2020, she admitted there had not been enough preventative and early intervention services before COVID. In 2021, she again said long waits are always unacceptable, and we've heard the exact same script all over again today. Why does Nicola Sturgeon think it's acceptable to use the same hollow words year after year for 8 years, while nothing changes, families are left to suffer, and kids are left to pick up the pieces on their own?
First Minister.
Well, that is not the case. What we see with mental health treatment is more people coming forward for treatment. More people are being seen for treatment, but we are building services. So Anna Sarwar has put forward what he describes as solutions. He has not said anything today that is not already being done and happening. So, for example, we are right now recruiting 800 additional mental health workers for A&E departments, GP practices, police station custody suites, prisons. We're funding 1,000 additional staff to be in community mental health to build resilience there and ensure that every GP practice does have access to a mental health and wellbeing service. We are recruiting 320 additional staff in child and adolescent mental health services. We already see CAM staff at a record high, and so all of this is being done. More people are coming forward, but we are seeing more people treated. The fact that I mentioned, I think, in my first answer, which Anna Sarwar has glossed over, is that in the figures published this week for the most recent quarter, we saw a record high number of children and young people seen by CAMS services. So progress is being made because of the investments and because of the policies we are introducing. Is there much more work to be done? Absolutely there is, which is why we're going to get on and do it.